Alright, so today we're going to be exploring Wernicke's aphasia, a type of language disorder that affects comprehension, making it difficult for people to assign meaning to the words they hear, read, or even produce themselves. Wernicke's aphasia is sometimes called receptive or fluent aphasia. People with this condition often speak fluently, meaning they can produce words and sentences with normal intonation and grammar. But here's the catch. While their speech flows, it often lacks meaning. They may use real words, but those words don't make sense together, or they might even make up new words entirely, known as neologisms. This happens because of damage to Wernicke's area, which is located in the dominant hemisphere of the brain, typically the left side. Wernicke's area is responsible for giving meaning to language, both spoken and written, and it helps us comprehend what others are saying. So, when this area is damaged, people lose their ability to understand language, and their speech, although fluent, becomes nonsensical. The most common cause of Wernicke's aphasia is a stroke that affects the left middle cerebral artery, but it can also be caused by traumatic brain injuries, brain tumors, or cerebral hemorrhage. Now, let's talk about the symptoms. The hallmark sign of Wernicke's aphasia is impaired comprehension, meaning people with this condition struggle to understand both written and spoken language. They're often unaware of their speech errors, so they might not realize that their words don't make sense to others. Their speech can be filled with jargon, using real words in meaningless combinations, or even made-up words. For example, someone might substitute similar sounding words like saying nog instead of dog, or use entirely unrelated words like saying spoon instead of fork. These types of errors are called paraphasias. Another common symptom is circumlocution, where the person describes an object without using the word for it. For instance, instead of saying pin, they might say, it's pointed, thin, and you write with it. This shows that they know what they want to say, but can't find the exact word. In more extreme cases, individuals might go off on tangents, producing run-on speech that's hard to follow. For example, if asked what they do at a pet store, they might say something like, the pet store is a place, it is a place with many pets, and pet food, my favorite animals are dogs. At the pet store, I buy food for my dog, there are also fish at the pet store. When it comes to diagnosis, doctors typically use imaging techniques like a CT scan or MRI to identify the cause of the aphasia. A CT scan may reveal stroke or bleeding, while an MRI can provide a more detailed view of the brain and help pinpoint where the damage is. Sometimes, functional imaging techniques like SPECT or PET scans are used to observe how different regions of the brain are functioning in real time. As for treatment, the primary goal is to address the underlying cause, whether it's a stroke, injury, or tumor. Speech therapy is critical and should begin as early as possible to help individuals recover their language skills. Most people improve spontaneously within the first month, but ongoing therapy can make a big difference in regaining language comprehension and communication abilities. So, to wrap it all up, Wernicke's aphasia affects comprehension, leading to fluent but nonsensical speech. People with this condition might not be aware of their errors, making it difficult for them to communicate effectively. Early intervention with speech therapy is key to improving outcomes. If you're interested in learning more about topics like this, be sure to check out King of the Curve and download our app for access to a wealth of educational resources. Whether you're prepping for exams or diving deeper into the world of neuroscience, King of the Curve has everything you need to stay ahead.